Hi, I'm Jeff Bloomberg. I'm the Chief Operating Officer here at MGE. And for this week's tip of the week, I want to talk about deactivating patients. More specifically, when should you deactivate a patient? And I'm going to apologize in advance. I tend to be very verbose, as many people will tell you. So this tip is a little longer than usual, but bear with me and watch the whole thing because I think you'll get a lot of benefit from it. Now, coming from the business world into the dental industry, one of the things that always fascinated me was in dentistry, there's sort of this unwritten rule that if a patient hasn't been in for 2 years, they're inactive, and I've seen plenty of instances where chart audits occur and these patients are purged from the patient base because they didn't call back or they didn't make an appointment. Now, it's really interesting because in the business world, there's all these metrics on the cost of customer acquisition and the cost of retaining a customer, okay? And in dentistry, if you take a look, I've seen varying averages, but the average acquisition fee for a new patient is roughly $300. So in essence, what you're doing is you're spending all this money to get a new patient in. Then if they don't call back immediately when you call them to reschedule them, if they miss a recall appointment, the patient is then, after a while, they may be called once or twice. And you know how chart audits go. Usually people start at A and they get to about E before they get off into doing something else. Some people start at Z and go up, which means, LMNOP never gets called. But ultimately what happens is if the person doesn't come in, they're purged from the active patient base, and all that money you spent on acquiring them is basically wasted. And this is sort of unheard of in the business world. For that matter, I still get catalogs from places that I shopped at years ago. If I don't show up at Restoration Hardware after 2 years, it's not like they're going to stop mailing me catalogs or trying to get me back. So there's really no reason to deactivate a chart. And in a lot of cases, what you'll find is you'll have a patient who came in 3 years after being deactivated, and you come in and let's say you're extracting a tooth, which you tried to save at one point, and now this person's ready to be a good patient. And you ask, hey, where were you? And they got tied up with a bunch of other things. But in this person's mind, they were always your patient. They never thought that they weren't your patient. You may have thought it, and that's why you purged them out of the charts, but in their mind, they were always your patient. So it's actually kind of silly to deactivate a chart unless they meet a certain basic criteria, which I'm going to go over with you here in a second. But ultimately, here's the bottom line. Most people, if they're not coming back, still consider themselves your patients. But the easiest way to lose them is for you to not consider them your patients, which we'll talk about in a second. So when should you deactivate a chart? Well, obviously, if somebody passes away, you deactivate a chart. Or if the person states that they want to leave for some reason, in which case I would always suggest that the doctor talk to the patient if a person's leaving the practice for a negative reason. Or you may not want the patient anymore, in which case you've dismissed the patient and they're deactivated. Or the patient moves out of state. I don't know that anybody's going to come from South Carolina if your practice is located in New York. All right, lastly, what if the patient goes on to another insurance plan? Well, at that point, you probably want to take them off of the recall list, but I would still recommend continuing to mail to that patient, whether it's a newsletter, seasonal mailings, things of that nature. Because if you've ever been in a plan, you've probably seen instances where a patient goes to an office that they maybe switch to an HMO, and they go to the office that uses that HMO, they get sick of it, and they come back to you, and they're ready to pay your full fee. So you don't do recall calls. It's a little bit of a different thing, but you still keep them on your mailing list. So what does this all tell you? You need to continuously communicate with your patient base, whether it's through newsletters, seasonal mailings, regular letters, or in any event, what I would be doing is calling them too. I would continuously call, even if it's once a month, to reactivate. You have to keep the communication in, and for that matter, the post office will stop forwarding mail if 6 months have gone by since a forwarding order has put in. So this is a way to end up with bad addresses. If you're not mailing anything to your base, what will end up happening is you'll get these things back saying the person's address is no longer good. So if you're mailing regularly, you can stay on top of people's addresses. Now, if you'd like, MGE has a really cool reactivation program, which is a series of steps, step by step, on how to reactivate patients who have gone inactive. And in our description for this video, there's a little link you can click where you can download the reactivation program. Or you can email me here at jeff@mgeonline, which is appearing here on the screen now, and I'm more than willing to send you a copy. Otherwise, that sums it up for this tip of the week. If you hadn't had a chance to do so already, we put out these tips once a week. Please click the subscribe button and subscribe to our channel. And if you want more information about MGE, you can call us at 800-640-1140 or go to our website, mgeonline.com.